Thank you so much for joining us today for the How to Implement Lead Poisoning Prevention Strategies, Resources, and Education during home and virtual visits. We want to give a big thank you to CareSource, who's sponsoring our webinar today, and just a reminder that they have not influenced in any way the content of today's webinar. A couple of disclosures. Dr. Newman, one of our presenters, does receive research funding from Meridian Bioscience to study screening tests for lead. He will not be discussing any specific lead testing devices during today's presentation. And I want to give a moment for our two presenters to briefly introduce themselves. Today we have Dr. Nicholas Newman and Dr. Rupa Thakur.
Hi, I'm Dr. Nick Newman. I work down at Cincinnati Children's Hospital, and I've been involved with caring for children with lead poisoning for quite a while now. But also, I've worked with our local practices as well as some practices around the state to implement lead primary prevention for kids, as well as follow-up and testing and stuff like that. So I'll hopefully be able to talk a little bit about that today.
Thank you.
All right, thank you, Kristen, for having us here today. Hello, everyone. Thanks for joining us. My name is Rupa Thakur. I'm a primary care pediatrician at the Cleveland Clinic. I have an interest in population health and advocacy, working with the Lead Safe Cleveland Coalition, and I'm serving as medical director for the Ohio AAP's Lead Free Ohio program. So very excited to be here today.
Thank you so much. And I should have introduced myself as well. I'm Kristen Fluitt. I'm the Senior Quality Manager at the Ohio chapter of the American Academy of Pediatrics. And just to let you know, the learning objectives for today are to learn strategies to incorporate lead poisoning prevention into in-home, in-office, and virtual visits, increase skills in providing lead poisoning prevention resources for families, and improve support. Sorry, I have someone who's entering. Improve support for families with lead exposure concerns. So let's a couple other folks in. And then we wanted to get a sense today of just who is joining us. So I'm going to keep my fingers crossed that technology cooperates, and I'm going to launch a poll just to ask you what your occupation is. Select the answer that best fits, and we'll give you just a little bit to do that. I'm seeing some results coming in. It looks like we have a good mixture today. We have quite a few community health workers, some home visitors, a couple of physicians, and a couple of nurses or nurse practitioners. So I'm going to end this poll and just show you the results of that so that you can see who is actually with us if you answered the question today. Thank you. And please remember, chat anything you would like in the chat box. We'll be monitoring that, and we will also be answering questions there. So please feel free to do that as well. All right, and with that, I will turn it over to our presenters.
Thank you. So it's nice to see that we have a good mix of folks joining us today. But no matter what our role is, we all share the same goal, which is that no child should be exposed to lead. So this is why primary prevention is so important. The definition of primary prevention is intervening before health effects occur. So a very common example we use of this would be vaccinating an infant now to prevent a life-threatening illness if she might be exposed to an infectious disease in the future. So in the case of lead poisoning, primary prevention means removing lead hazards from the environment before a child is actually exposed. We know that there is no safe level of lead in the body and that the effects of lead poisoning cannot be reversed. It's critical then to understand the common sources of lead in our environment, in our homes, and to learn to prevent or learn preventive strategies to minimize our children's exposure. The next slide, please. So prevention can take a few different forms. We can reduce lead hazards by addressing our housing stock and making homes lead safe. We can also provide education around and enforce rules around lead safe renovation practices. These interventions require a lot of resources and will take years to achieve on a large scale. So in the meantime, we think about reducing lead exposure within the home through rigorous cleaning and hygiene measures. And we think about the effects of a good diet on reducing lead absorption as a form of prevention as well. Next slide, please. The most common source of lead, as we know in Ohio at least, is lead-based paint. Go ahead and hit next one more time. So 80% of Ohio's lead exposure comes from lead-based paint, but 20% comes from one or a combination of other sources. Lead contamination can also occur through occupational exposure. It can be present in our soil, our foods, herbs, spices. Toys may be painted with lead paint. There are a number of traditional cosmetics, medicines, or ceremonial powders that can contain lead as either a main ingredient or a contaminant. Water contamination can reflect sporadic failures of corrosion control, or maybe reflective of low-level leaching, kind of constant leaching of lead from pipes over time. And because we're drinking water so frequently, hopefully, you multiply the small amount by the large amount of water that we take in, and you can see that the total exposure can then be quite large. When thinking about water contamination, it is important to note that municipal water lines or service lines are typically not made of lead. It's the lines from the service line to the home that were made of lead historically. And lead pipes were banned nationally in 1986, although some cities or counties may have banned them even earlier. And lead plumbing and fixtures were allowed until 2014. Next slide, please. 80% of kids are exposed by lead in housing, as I mentioned a moment ago, and 2/3 of Ohio's housing was built during the lead paint era before 1978. This represents much of our inner city as well as rural housing stock in the state. And the highest amount of lead can be found in homes built prior to 1950 and is found in the lead contaminated dust from deteriorating paint that coated doors, windows, trim, and porches. Next slide, please. When we look at lead-based paint in homes, it's of course not just the age of the house, but also the condition of housing and the neighborhood in terms of ongoing maintenance that factors into the degree of lead exposure. So if it's an older home that has been regularly repainted and wet mopped frequently, the exposure risk will be much lower than a home built in the same year, but with chipping paint and dust accumulation in areas where children might play. Next slide, please. And then outside of the home, parents might bring lead particles home from work. High-risk occupations include construction and renovation, those who work with lead batteries or lead recycling, welders, plumbers, and firing ranges. Next slide, please. So what should we tell families to do to prevent lead exposure in the home? If they have chipping paint already, they can temporarily cover those areas with tape to prevent flaking and further deterioration until they have a chance to address it more permanently. They can use furniture or other physical barriers to block access to windows or areas that may be known to contain paint, lead paint, I should say. If a home is actively undergoing repairs or renovation, areas known to contain lead paint should be blocked off with a ceiling to floor tarp or other barrier to contain the lead particles while work is going on, and children should of course be kept away. All surfaces should be wet mopped frequently to remove lead particles. Dry sweeping should be avoided because this might actually just pick up the dust and spread it around the home or make it easier for it to be inhaled. And families should know that they can periodically borrow a HEPA vacuum from their local health department to get a deeper clean every now and then. Next slide, please. If there's a family member with occupational lead exposure and they have access to showering facilities at work, we would ask them to change their clothes and shower before leaving work to prevent tracking lead particles through their car and home. If that isn't possible, they should remove their clothes and shoes before entering the home, shower immediately upon entering the home, and wash their clothes separately from the rest of the family to prevent cross-contamination as much as possible. Next slide, please. We should counsel all families on general hygiene practices that can reduce lead exposure. We know that hand-to-mouth behavior is developmentally normal and appropriate in infants and toddlers. In a home with lead paint dust, though, a small child could easily pick up lead particles on their hands and immediately put those hands in their mouth, resulting in lead ingestion. Older children with developmental delays, resulting in persistent hand-to-mouth behaviors, or those with pica, eating non-food items, would also be at significantly greater risk for lead exposure because that behavior continues for a much longer time. It can be helpful then to wash hands very frequently, especially before mealtime and bedtime. We also know that soil contamination is very common around older homes and in neighborhoods with nearby high-risk industries. So for this reason too, it can be helpful to remove shoes at the door so that we don't track lead contaminated soil through the house. Next slide, please. And then we also know that nutrition can affect lead absorption. Children who are iron deficient absorb lead more easily. So a diet high in iron or a multivitamin with iron can be very helpful. Vitamin C aids in iron absorption, so some extra citrus and veggies can help. And dietary calcium decreases GI absorption of lead, so low-fat dairy products should be encouraged as well. Next slide, please. As I mentioned before, there are many other sources of lead in the home, including imported spices, traditional remedies, ceremonial powders, and cosmetics. The EPA and North Carolina Healthy Homes websites have wonderful handouts like these that can be useful in helping families identify potential sources of lead in their home, and it can help with having those conversations as well. Next slide. So we've talked about primary prevention. Secondary prevention includes blood lead testing with associated follow-up care and referral if positive. We can do this by capillary or venous draw. Each have their pros and cons, but it's important to note that an elevated capillary test must be confirmed by a venous test pretty promptly. So there is that one difference in terms of workflow there. Next slide, please. So why do we do blood testing? This step allows us to identify children in which primary prevention failed and they were exposed to lead. It gives us an opportunity to treat the affected child and address their environment to further prevent lead exposure with the goal of reducing blood lead levels as rapidly as possible. Next slide, please. The Ohio Department of Health requires lead testing for those patients who are Medicaid eligible and living in a high-risk zip code, or have ongoing exposure risks based on the age and condition of the home, whether they might have a sibling or playmate with a history of lead poisoning, a family member's occupational exposures, or the home's proximity to a high-risk industry known to generate lead dust. Next slide, please.
If I could just stop for a moment, we had
sure.
a question in the chat that I thought might be good to answer here. Is it possible to have false positives or negatives with the capillary draw?
So it is possible to have a false positive, which is why we do the venous test to confirm it.
Okay, great. Thank you.
Mm-hmm.
Can I comment for a second too? Do you mind?
Yeah, go ahead.
So one maybe like good thing about a positive capillary test is that sometimes when the idea is that there could be some contamination on the skin with lead and the kids may have touched something in their environment. But let's say if that comes back at like 25, but the venous test comes back undetectable, then it actually gives you an opportunity to try to prevent somebody from getting exposed. So like, I think, I almost think like when you're thinking about a public health intervention, you almost have to think a little bit differently about like the false positive negative idea a little bit, because I mean, it's still valid. So I'm not, but like just thinking about how you would use the test. And I think like if the goal is that nobody has lead in their system, finding it on the outside actually gives you a chance to prevent that next step from occurring. And I think, I think it's one of the hard parts of all of this is, it's like it's hard for us to measure how many kids don't get meningitis because we gave them a shot to prevent it. You know what I mean? And so, but I know just something to think about a little bit, because I know practices are often struggling either way. Like, do we want to get venous for everyone or capillary, or do we just screening, and like all the reporting requirements and stuff. So just something to think about. That was all. Thank you.
It's a great point, Dr. Newman. Thank you. All right. So by law in Ohio, we must order a blood lead level at 12 months and 24 months for any patient that is on Medicaid or living in a high-risk zip code. If we see a child between the ages of 3 and 6 years who is on Medicaid or living in a high-risk zip code but never had a lead level done before, we should order a lead level at least once. Next slide, please. Once we've performed that test, Ohio law mandates that lead levels be reported to the Ohio Department of Health. Lead levels greater than 5 are flagged, prompting a call to the family. An automatic referral to Help Me Grow for early intervention services is also generated, who will call the family as a second phone call to schedule an evaluation. Levels greater than 10 should also result in a home inspection performed by the local health department, initiating the abatement process. Next slide, please. We see then that the roles of clinicians and public health officials are complementary. Both should provide counseling and interventions aimed at primary prevention. A clinician is responsible for testing, reporting, and medically managing elevated blood lead levels. Our public health system is responsible for case investigation, tracking, and enforcement of public health interventions to prevent further exposures. Next slide, please. Over time, the acceptable blood lead level has decreased in response to increased recognition of the effects of lead toxicity. The CDC is currently using the blood lead reference level to identify children who have a higher lead level than most children. In 2012, the blood lead reference value for children was established to be 5 micrograms per deciliter, decreased from the prior level of concern of 10. In the past 10 years, blood lead levels below 5 may or may not have been reported to parents. But the now new lower blood lead reference value of 3.5, established in 2021, just end of last year, means that more children will be identified as having lead exposure, allowing parents, doctors, and public health officials to intervene earlier for them. Next slide, please. The vast majority of cases of lead poisoning are acutely asymptomatic. They don't show any signs of toxicity. This is why we screen based on risk of exposure rather than just symptoms alone. If they do have symptoms, these might include irritability, behavior problems, abdominal pain, lethargy, loss of appetite, headaches, memory loss, and in the event of very high levels, we might see seizures. These are, for the most part, pretty vague symptoms, and unless you're thinking about lead day in and day out, you might not immediately recognize these as symptoms of lead toxicity. You might be thinking along other lines first. Lifelong consequences of lead exposure can include decreased bone and muscle growth, hearing loss, damage to the nervous system, ADHD, and developmental delays or decreased IQ. This is why it's so important to try to catch it early before they start showing symptoms. Next slide, please. There is data to suggest that up to 25% of ADHD cases may be attributed to lead exposure, and that antisocial and criminal behaviors in adults may also be linked to lead exposure. Next slide, please. Academic performance suffers proportionally to lead level as well, with evidence to support this shared by the Detroit Public Schools. So shown here is the predicted probability of failure on the Michigan Educational Assessment Program's tests in math, science, and reading as a function of blood lead level, which you see across the bottom axis there. Marked here, you can also see, if you hit next for me, please. Yep, you see the current CDC reference standard of 3.5 in blue, and the state's current threshold level for home inspection, et cetera, in red at 10. And so if we look at math in particular, that solid line, if we hit next again, please. You can see that the probability of failure with a blood lead level of 3.5 is about 30%. And if we hit next again, you can see that the probability of failure with a blood lead level of 10 is just shy of 50%. That's a huge difference in academic outcomes at relatively low lead levels, you know, what we used to think were low or within acceptable range. And it reflects an opportunity for our system to improve in terms of interventions available for lead levels under 10. In addition, this demonstrates the ultimate take-home message, which is that primary prevention was really critical to our children's success. Next slide, please. One of the things we can do is early intervention. Early intervention with speech, physical, or occupational therapy is critical to optimizing outcomes for these patients once we identify a delay. As mentioned before, referrals to Help Me Grow are automatically generated from the Ohio Department of Health when a lead level over 5 is reported. So in this scenario, the family should receive 2 separate phone calls, as I mentioned before, one from Help Me Grow to arrange an evaluation and one from the Department of Health. However, we know that many attempts to reach the family are unsuccessful and this loop isn't always closed. So it can be helpful for us to have a conversation with the family about this process and give them a heads up that they'll be expecting these phone calls so that they can respond promptly, pick up the phone, call back, whatever's required of them. Outside of the automatic referral process, PCPs or parents or really anybody can refer using the online referral form or a phone call. The potential outcomes of early intervention include addressing the home environment, improving diet, and encouraging activities that promote development to mitigate the effects of lead poisoning. So we know that there's a lot of good that can happen from this referral. Next slide, please. All right, I'll turn things over to Dr. Newman.
Thank you very much. So I just want to touch on like kind of the next part of things. You saw that diagram of like checking the lead level, and then it goes to ODH, and then it goes, you know, and all these other things happen. So you're just to think about it, like public health, they are not seeing patients, right? Like, so their job is really, I mean, they do see the families and the kids like often in the home, right? But their main tools are education, investigation, and then enforcement. And there are, you know, they have an interesting set of roles, you know. So one of them is like, you know, feels really benign, and the other one feels like not, right? So next slide, please. So where would a community health worker fit into this? And, you know, I've worked with some of our community health workers down at Cincinnati Children's about trying to help families who have a lead poisoned child try to navigate the system, right? And so, you know, if you're talking to someone on the phone or maybe in clinic or something, this would be an opportunity to talk about like all these different sources, you know, like, oh, you know, about the house, like what does the condition seem to be? Like, what do the parents do for work? What do other adults in the home do? Where does the child go? And, you know, it might be that, you know, you have a child that, you know, whose parent works in construction. And I have a lot of parents, like they don't know that they could be bringing home stuff from their work. And just knowing that can make a huge difference. Because really, like all these things that we're doing otherwise that everybody talks about, you know, oh, improving the diet and all these things. If you don't get rid of the source, like you're not really getting rid of the problem, you know? And so that's the key part of this whole, like the whole linchpin of the entire thing. The other thing that I've found is that, you know, a lot of kids, like lead is the kind of the tip of the iceberg, or like the one thing that you can measure that flags like in the computer, you know, as being red and abnormal. But a lot of the families have other issues going on. You know, they've, you know, in Cincinnati, a lot of Ohio, there's a lot of older houses particularly in the urban areas, and not all these houses are in bad shape. So this is like a subset of kids who live in old housing that also has other problems often. And, you know, because of that, the families may have trouble with food insecurity or transportation, et cetera. And so getting all these other things done helps to deal with the lead problem, because then they're not, you know, you've got all these things you're worried about. Okay, what am I going to feed my kids? How am I going to get to like work or appointments or whatever? Like, what am I actually going to do? Now, some community health workers do home visits, and I think, you know, it's well beyond the scope of what we're talking about to train people on like identifying all the lead hazards in the house. But, you know, and often just a keen observer will be like, oh gosh, that's all that paint is chipping over there. You know, if you talk to the landlord, or if you own the house, like, oh, well, what can we do to try to help you get connected to maybe some community services to help make those repairs? And there are common solutions to some common problems, like, you know, Dr. Thacker was talking about, you know, wiping things down, cleaning, leaving your shoes at the door. And the truth is like, yeah, you want to find the source, but you can start to do things to reduce some of the exposure along the way. And like I said, implied before, like connecting people to resources to maybe help them out. That might be, maybe taking the uh, demystifying like what the health department's going to do, or demystifying what Help Me Grow is going to do, so that families, if they need these services, they'll actually use them. Next slide, please. So maybe like there's this ideal situation, which I've kind of pulled together from various patients I've seen over the years, right? So the ideal situation is, after the lead poisoning occurs, family owns the home and they have the means to get the hazards fixed. And the family is like very functional, and they're really concerned about their child being exposed, and they're doing all kinds of enriching and things already to try to make things work for their child. And so the state has some subsidy even for people who are not low income. There's a income tax credit, which from what I've heard from the state is a bit underutilized. So like this is something that more people should probably know about. And they were able to get everything fixed up within a few months, and it was all good. And this was, we would say, like kind of this is a manageable problem, because there aren't a lot of other things going on for this this child, and you would expect things are going to do better. And in fact, the studies that have been done have shown that kids who are in like a stable home with like a stable family income, they tend to do better than the kids who are in a less stable one. So next slide, please. And so like here's the non-ideal situation, but maybe like slightly significantly more common, where the family, and I have families who just say, I ask them about the apartment and they start telling me all these kind of horror stories about, yeah, there's water leaking in, and all the drains are blocked up, and when it rains, the sewer backs up into the basement, and it smells awful. And like I'm like, oh my gosh. It's like, well, have you talked to the landlord? They're like, the landlord. Yeah, we talked to the landlord. He's a slumlord. He's not going to do anything. I'm like, okay, great. So, and they're afraid that the health department's going to come because this was the only place that they could rent. There's, a big mess like all through the whole house, but then they also have other issues that they're worried about that are more pressing, like food insecurity. Mom maybe having a lot of stress, like trying to deal with things. Older siblings are also having problems. So there's a lot, like lead is literally the tip of a huge iceberg of things that have to be dealt with. And it's sometimes hard for the families to prioritize these things, to know how, like what the order of operations is to try to fix that. And I know, with the kids I see, like our social workers, our community health workers, our nurses, everyone really helps them navigate, like, break it down into manageable chunks. Like, okay, right, we're going to try to help you with this, and then that, and you got to apply for this, and help them move along, and get some small successes so they realize like they can actually handle this. Next slide. So, one way to help families out is to do like just even a brief history, like, what do you do for a living? What's your house look like? Where does your child go? And that gives you some inkling about where possible exposures could be, and you could talk to parents about that. There are a whole bunch of resources through the state. I mean, we're lucky in Ohio compared to where Cincinnati is located. I deal with Cincinnati, Ohio, Indiana, and Kentucky, and each state is vastly differently resourced in terms of trying to help deal with the lead problem. So there are a lot of educational materials, and I try to discourage people from going on the internet looking for stuff, because like you Google like lead poisoning in children, and almost immediately you're down a very deep hole of like all kinds of like very, very strange advice and recommendations. And there's not like a single like easy silver bullet. Like it's all like just kind of the diligent work of fixing the problem. And these are some like useful phone numbers that'll be in the materials that you'll have later. Next slide. So we talked a little bit about like what happens like in order. So, basically the state law requires that after the lead test is done, it has to be reported to ODH. And then ODH figures out where, like who needs to deal with it next. So, if you live like around, I'm just speaking around the Cincinnati area. So like if you live in the city of Cincinnati, we have our own health department. And so the Cincinnati Health Department does the case management and the lead investigation. And but if you live further out, like maybe Claremont County or Warren County, they don't have a dedicated lead program. And so the Ohio Department of Health sends someone down, but they rely on someone locally for case management. And often I find that's where things break down a little bit, because if the health department doesn't have the resources to allocate staff to do that, that's often a point where like our hospital and some of our resources will help families with the kind of navigating through this. The lead investigation. So like there's kind of like two levels to that. And Dr. Thacker implied that earlier. So the children who are 5 to 9 right now, the lead level is 5 to 9. For the most part, they'll get a phone call from the health department. Now, in certain jurisdictions, like for Cincinnati, for instance, they actually send a specially trained nurse to the house to do a home visit and to provide some healthy homes advice and assessment of the home. And they also try to help families get connected to resources to deal with the problem. A level of 10 or higher prompts a environmental risk assessment. So like basically that means an inspector is really a sanitarian, right, who goes to the house and they collect samples of stuff, dust samples. They have an XRF machine so they can read, like actually right there, they'll zap it and they'll say, oh, there's lead in that railing over there, or oh, there's lead in those toys you have there. You know what I mean? So it can be very helpful to families to find this stuff out, but it'll take like often a month or so to get the whole report back. And then, as was previously discussed, Help Me Grow gets involved because we're anticipating that a percentage of kids may have developmental problems or behavior problems as a result of the lead exposure. But some kids already come in with some existing problem, and it's often helpful for Help Me Grow to help those families with kids who are already having maybe problems with speech, or they're having problems with behavior, and giving the families some additional resources and tools for their tool chest, and to help them get connected to services later. Next slide, please. So I won't read these all off. These are meant for your information. These were created by the Ohio AAP, where we pulled together like a whole bunch of different resources around lead into one place, so they're easier to find. And these are reputable sources. This isn't just like randomly going out on the internet and finding something. Next slide. So medical management, and it isn't expected, of course, that looking at the participants, like that you're necessarily going to be doing the medical management yourself, but you're going to be helping the families understand what the medical management is. This whole like kind of navigating the system, if you will. So right now, and if you recall, the earlier slide said that the CDC is now, their reference level is now 3.5. And if you look, all these things are talking about 5. So the Ohio Department of Health, hopefully in the next like few months, will be coming up with some new guidance around this. There's going to be some meetings that myself and some other folks are going to be involved in to try to advise them a little bit on where to go with it. But understand that, the average lead level for a kid in the United States is less than 1 right now. And so if you have a lead level of like 5, that's actually pretty high in the standards of like, lead levels. That would be like, okay, well, we checked your cholesterol and it's come back at 500. Well, if it was 500, people would be like freaking out, right? So, if it's supposed to be like around 100, 120 or something like that, right? So but the point here is not to freak out. It's that you want to take action. And so part of this is you want to try to figure out, is there some, is there some obvious source somewhere you could help the family with? And and if the children were tested, at age 1 and it was still detectable at 5, you're going to have to check them again at least at age 2. So next slide, please. And then as the lead level goes up, there's going to be more testing, but more intervening. And as was discussed, a lot of the interventions are public health interventions. So they may not be something that is happening through the clinic or through the hospital, but it's something that families should be aware of so that they understand like what the progression of things. And if you look at that last one where it says over 45, I mean, that's often like the kids who end up in the hospital, because once you get to 45, it's not a big jump to get somewhere where you're actually like acutely sick from lead poisoning, like you can't walk anymore, or you can't, I mean, one of the first case of lead poisoning I encountered as a resident back in Detroit, so like over 20 years ago, was a girl who was brought in because her mother was concerned because she couldn't walk or talk anymore. And this was a child who could walk and talk previously. And the lead level was so high that it had poisoned her brain that she couldn't do those things. So like that's a huge problem, but it's luckily rare. Next slide, please. So I think one of the things to talk about is like before the testing is done, like parents should know that it's coming up, right? And the reason that we do lead testing is that lead is a very common but preventable cause of learning disabilities in children. In fact, the WHO, World Health Organization, labels it as the #1 like preventable cause of learning disabilities across the entire world. So, and since no amount of lead is safe, like it's the thing, the primary prevention is where we want to put most of our effort, but there are going to be kids who are going to be high. And so we're going to have to do something about that. And unfortunately, we won't be able to intervene if they don't get tested. So only about half the kids in Ohio who are high risk are actually getting tested. And so that's one of the issues that we have. And the state and some of the local governments have resources to help families with this. And in most situations, we talked to diet was discussed, but iron is particularly important because that seems to be a key moderator in terms of how much lead you'll absorb, right? But also, if there are kids who are low in iron, they also tend to have a lot more oral behaviors like pica. So like they're eating stuff that isn't food. And so that puts them at acute risk for extremely high lead levels. And I can think of a kid, I've seen the last year or two, who the parents like, the kid was very low in iron. He was a little bit premature. And so, he didn't get that, bit of iron at the end. His parents were very loving. They were trying to do everything they could. And then, next thing you know, he's putting everything in his mouth, including like the paint chips that he like pulled off the wall. So, after the tests come back, I mean, the families also have to understand that they're going to require follow-up. And even though we can't necessarily reverse the effect of lead exposure, it's beneficial to minimize how long it's high. It isn't just like what it is on a single point, but like, if the level stays, let's say 10 for 3 years, that might be worse than 20 for a month. You know what I mean? And so it isn't just like how high it is, but how long it stays high. Next slide, please. So we have a little example case. This is kind of distilled together from some cases who've come through our clinics down in Cincinnati. So Timmy is a year old. He's coming in for his child visit. And he lives in an apartment with his mom and the two older siblings. Mom doesn't know the age of the building. So like, there's that questionnaire where you're asking, oh, is a building built before 1950? A lot of parents don't really know, particularly if they're renting. People who own the house usually know, but people who are renting often don't. Now, he also visits his dad who works in construction, and mom reports that the dad lives in an older building with dad's mom, so the paternal grandmother. Mom goes to school during the day, and he attends childcare, and he's insured by Medicaid. And so the question, and hopefully the poll will work, does Timmy need a blood lead level?
All right, so I'm seeing folks are answering. We've got about 8 people who've answered. If you don't mind, you should be seeing the poll. If you could go ahead and answer. We'll give it just a couple more. Got 11 folks, so just maybe a couple more people. And then I'm going to end the poll and I'll show you the results. All right, and hopefully everybody can see that. It looks like we had 13 people answer, and all of those said 100% said yes.
Yay. So that is the right answer, yes. And next slide, please. Sure. Yes, so according to state law, he needs a lead level. And mainly because he's 1 year old and he's insured by Medicaid, right? But also, if you were, if you're listening, there were a few other things thrown in there too that might be risk factors, right? So like dad's occupation, like, so maybe the construction and the housing, we don't know, right? So that's also kind of questionable. If you just throw the dice in Ohio, right? Like 2/3 of the houses were built before the lead paint era, during the lead paint era. So you might hit the quote jackpot, right? So next slide. So the next step, they do check the lead level. It comes back at 7.5. The local health department contacts mom and provides them with some information. They just, do like over the phone visit. And just the stuff we talked about, like wiping things down, encouraging iron-rich foods, discourage any like stuff in the mouth. But the lead level should be followed up in about 3 months. So if it's high, that means you need to follow up. It isn't like, oh, we'll wait till they're 2. It's like, no, we're not going to wait till they're 2. Next slide, please. So mom has diligently been cleaning the home, right? Dad's been changing his clothes. His lead level, they check a lead level, and then they also check a blood count, and they've checked iron, which is, per the AAP guidelines. And the lead level's gone up. And you can see like his hemoglobin's a little low and his ferritin is low, which means that he's a little bit anemic, and he's also, his body, like his iron storage is also low. So the Ohio Department of Health then comes out to do a lead risk assessment in the home. And I guess like one of the things to say, well, gosh, mom's been doing everything she's supposed to and it still didn't work out. So like one of the problems is like if you don't find the source and like definitively deal with it, like the amount of lead dust that it takes to raise your lead level is really just so minute. Like you're talking about like, it looks like just like a few grains of salt, basically. So like, yeah, cleaning your house is good, but no one cleans their house using a microscope, right? So like, you just have to, and if there's a source that's still ongoing, it's going to be very hard to get ahead of that, right? It'd be like, oh, the air pollution is really bad today. You need to just like not breathe, because that's the way you're not going to get exposed. No. The way we deal with air pollution is we get the source and we reduce it, right? So same idea. Next slide, please. So turns out mom's house is pretty old. It was like over 100 years old. and they found lead hazards on the windows and trim, as well as like the dust levels being high on the floor. So this picture here is a picture of the XRF machine. So they're actually directly reading the amount of lead like in the windows and trim right there. Now there was also a little bit of water damage from a previous roof leak, and the plaster had bubbled, and there was a little bit of like cracking and some dust. He's hit, you know, gosh, they've hit the lead jackpot here, right? So like there's bare soil in the backyard, and he plays back there. So the thing is, like, all these sources all add up. Like there's a little bit coming from here, there's a little bit coming from there, and it all adds up to be what, you know, his lead level of like 12 and a half, right? So, and he drinks way too much milk. And so like one of the problems I see all the time is that, you know, parents are like, oh, it said calcium is good, so they give them way too much milk. And if you drink too much milk, that messes with your iron. And so now it turns out Dad's house was not quite as old as people thought, and it was also completely redone. And when they went out there, they didn't find anything. And Dad only works in new construction, so in fact his whole thing was actually a red herring. But this is not uncommon, right? You know, because often the parents, you know, let's say if mom is in there, she doesn't know exactly what Dad does all day in construction, right? So next slide, please.
We do have a question in the chat box that I'll bring up now. You may address this later, but just to get it kind of on the radar, are they able to pursue legal action against the landlord?
Yeah, so that's a good question. It all depends. I mean, my experience with this is that the lead cases, it's fairly the way the law is written in Ohio, it's very clear that it's the owner's responsibility to address the lead hazards, period. So there's not like much to debate. The problem is that the landlord may not want to do it. You can pursue legal action against the landlord, and I'm not a lawyer, so I don't want to make, you know, particular recommendations, but my observation, because I've been through a number of these cases, is that it takes way too long to achieve a legal remedy. The legal remedy is years and years in the making. And often what will happen is that the legal help that people often rely on is to sometimes to work with legal aid, if they need it, or legal aid just gives them the instructions to set up an escrow account should the landlord not be fixing things in a timely manner. But unfortunately, like the legal remedy, it doesn't, I mean, the system doesn't necessarily benefit the renter, just put it that way. Next slide. I don't know if that answers the question. So from a kind of the medical perspective, we want to try to deal with the iron issue. And then, you know, recommendations to the family. Well, if there's areas that there's some obvious lead hazards that the health department told you about, you can do things temporarily, like you can't mess with it, okay? Like you don't want to be in there scraping it down or doing anything. But I've had families, if it's around their windows, they're like, you know, it's winter anyway, we're not opening the windows, I just put the plastic sheeting over it. And you know, the kids' lead levels go down because there's a barrier now put up. You know, avoiding the soil in the backyard. I have a lot of families who take their kids to the park. They're like, the park's down the street, we'll just, you know, go to the park instead. And for the most part, the parks are maintained and there's mulch and there's people like looking into these things. So it's not, we've had very few problems, at least locally, with those kinds of public areas. And because the lead level's gone up, it's going to need to be checked at least a little bit more frequently at the start, just to make sure that nothing else is missed. Next slide, please. So it turns out there's some additional barriers. So like the landlord's very slow at getting the abatement done. So, you know, when the orders are written by the health department, it's 90 days from when those orders come down that they have to fix it. But in reality, like the landlords, whoever owns the house, they can easily get extensions. The extensions go on and on and on and on. After a year, the health department may put vacate orders on the house. if the lead hazards haven't been addressed. And so then this creates another problem for the family, like where are they going to live? In this case, Timmy, there was some problems with food insecurity and lack of transportation. Mom had to go to all these doctor's appointments, and now like taking time off for the health department visits. She lost her job, and so now she's got all kinds of like other problems that she didn't have before. And I can tell you that the problem with lead is that it's not like, oh, you have an ear infection, you take the pink medicine, one teaspoon twice a day for 7 days, and you're all done. This is like, okay, your kid's lead level's high, your house is messed up. Like, that's not like, I'll write you a prescription for that. And so there's a lot of other issues that come up. And this is often where like a community health worker, a social worker, care navigator, like any of those folks could help people like get connected with legal aid. Like, okay, what are my options? The landlord's moving very slowly. 90 days have passed, they've done nothing. Can we get like some like food from a food pantry for the family temporarily until we can help them get some other things arranged? Or, if they can't get to the pharmacy to get some medication, can we help with that, like home delivery? So I've used all of these things in our clinic. I mean, we're lucky to have a lot of good folks to help me out. Next slide, please. So to wrap up briefly, the primary prevention is key. So reducing the hazard, reducing the exposure, reducing absorption before people get exposed is ideal. Families need help getting through the system, testing, inspection, abatement. Like there's all kinds of like little things that go, forms that have to be filled out, phone calls that have to be followed up on. Important, the state of Ohio by law requires lead testing at 12 and 24 months for kids who are either on Medicaid or who live in a high-risk zip code. So there are a lot of kids who live in high-risk zip codes who are not on Medicaid. And then there are all kinds of resources to help families, and they're different actually regionally. Like Cincinnati has some great resources for helping families relocate, but not everywhere has that. But other places have like more involvement from Help Me Grow, where they're trying to address some of these other concerns. So I believe that's the end. Yeah, and there's a bunch of frequently asked questions. This goes on for a few slides. This is meant for stuff that you can have like with you. So I think we're pretty much, I'm pretty much done, and we have time for some questions too. So thank you so much for staying tuned in.
Yes, so if anyone has questions or comments they would like to ask, please feel free to unmute yourself. And now would be a great time if you want to ask those, or if you're more comfortable chatting those into the chat box, feel free to do that as well. The slide we're on now is just highlighting links to some additional resources that would be great to have, and that will all be in your follow-up email. Do we have anyone who has any questions or comments? I'm going to check chat again.
Yeah, I really think, like, from the work I've done, I found that a lot of the families, like the medical side of the lead is actually fairly simple and straightforward, even though it's hard sometimes to get like all the pieces to line up. But I would say some of the other like social issues are like way bigger, and it's sometimes really hard to help people get through that whole process. So
yeah, it sounds very complex to navigate, and it also sounds like sometimes it can be a bit of a mystery. I mean, when you find the lead level, it's still trying to figure out exactly where it's coming from, what all the risks are. It can take some work.
Yeah, and I've had a lot of families who, luckily, there was a they got really behind down here during the original COVID lockdown and everything, but luckily they've pretty much caught up with all the inspecting and stuff. So, when families feel a lot more empowered, like when they actually know what they're supposed to be doing. And I think that's because they want to help their kids. And so all that guessing, and I work with some other health department, like Ohio does an inspection if the load level is 10, but other jurisdictions might not go until it's 15 or 20 or 25. And, those families are getting really anxious, I can tell you. And because, by then they're well deep into the internet and they're just like, hold it, so part of what I try to do is to, what's the word, like kind of talk people down and say, okay, this is a manageable problem. We can help you with this. We've been doing, we've been helping people for years. And but yeah, and then there are in that FAQs, there's a lot of good stuff in there.
Yeah, it sounds like too, like that reassurance, and because it does sound kind of overwhelming. And then also I think when you learn your home may not be a safe place for your child, I can imagine the stress that would bring for a family. A couple of things I just wanted to mention in our last few minutes is, again, we have 2 additional webinars coming up in February and March in this series. They're focused on health and nutrition and healthy habits around that. So please, if you haven't registered for those, please do so. And I'll make sure the link to do that is in your follow-up email. This is just the more specifics on those. And we want to, again, thank you and thank CareSource for sponsoring today's presentation, and particularly thank our presenters today, Dr. Newman and Dr. Thakor. We really appreciate your time, and it was a wonderful presentation with a lot of great information and resources.